Welcome to the AUANews Inside Tract podcast. Today's Inside Tract podcast is part of the Voices series, which is brought to you by the Diversity, Equity, and Inclusion Committee. Here we'll be joined in conversation with committee members, AUA members, and urologists from around the world to discuss how to build a strong, vibrant, and diverse urological community.
No, my name is Raju Thomas. I'm a member of the AUA since 1986. And I've been in New Orleans since 1977. I've been all about urology and making sure that we do the best for our patients. I have devoted my career to minimally invasive techniques for urologic procedures, starting with the percutaneous on through the latest in robotic surgery. I've been with the Southeastern Section. I was president of the Southeastern Section in 2010, 2011. I've been on the committees of the AUA, including the Urology Care Foundation, and I was president of the AUA in 2021, 22. And I have been very much wanting the DEI initiative, which was part of my presidency, to really take off. That's the right thing to do, and which is what led me to the Future program. And I've been part of it now since its initiation, and I hope to continue as well. I've been privileged to have worked at the recent AUA Summit with Nader, who I believe symbolizes and epitomizes what urology at the AUA level should be doing, because here we have potentially active, ready to become a urologist type of person. And this message needs to go to all the Nadirs who we can work with and make sure that we connect with such students, so that not only do we get them into what I consider into medical school, but then once they are in medical school, then to see how we can make them interested in urology, because of the dire need, as well as the fact that connecting with our DEI initiative is fulfilled.
Hi, thank you so much for this opportunity and for the introduction. Again, my name is Nader Shayegh, and I'm a third-year medical student at Howard University College of Medicine. I grew up in Long Beach, California. I went to Harvard College in Massachusetts, and now I'm at Howard. I had my first exposure to urology with managing my grandfather's BPH, and attending all of his appointments, and seeing the relationship he was able to have with his urologist was really special. The multitudes of treatment options that was provided to him and the innovations to improve his quality of life really first drew me to urology. And medicine, advocacy was one of the reasons why I decided to pursue medicine. So being at the AUA Advocacy Summit was such a special opportunity to actually get involved on Capitol Hill, meet other like-minded peers and mentors and faculty to help better their community. So it was a really special experience. And in my journey in medicine, the Futures program was an amazing program to bring mentors and mentees together to explore urology.
From my perspective, Corey, this year's AUA Summit in 2024 was special because we had a much better representation. There were more faculty members who were mentors. We had good mentees. And I can tell you that I had a wonderful time with Nader Shayegh, because he was with our team as we went to Capitol Hill and visited our senators as well as congressmen from Louisiana. And I could see that the mentees' interactions, the mentees' interest, the mentees' involvement was significant. It's much better than I have seen in the past. And I think we should use this as a stepping stone to see how we can embrace such ideas and how we can make sure that can we get more Nadirs to join us next year so that, they can see the workings of the political process, how we could perhaps influence their decision-making process, how we could get the lawmakers to understand the urology needs with the patient being the center. Everything we talk about, whether it be telehealth or the pre-approvals, the workforce shortage, or other issues next year, is all centered around our patients. How can we, and here, of course, I'm just going to use the mentor-mentee, get together and present our case. And I can tell you this year, the mentee, Nader, was able to even talk and present his perspective to our lawmakers and their representatives. But we were fortunate to have a face-to-face meeting with Senator Bill Cassidy from Louisiana. So we certainly made him aware of our feelings, whether it was on telehealth or workforce, because Bill, being a physician himself, was aware of some of these problems, and he could understand and start working on these. So having the mentee also speak up was very heartwarming. And I think this needs to be expanded. And how are you going to get this to the next group of mentees? I don't know how to get that done, but I think it can be done, because if there is interest and if there is a feeling that the AUA Summit and beyond, whether it is also at the annual meeting, is here to embrace the underrepresented medicine and their journey into urology and into practice, that's what I think is important.
Yeah, and to reiterate, advocating on Capitol Hill was a really unique experience for me, to see the democratic process and the significant impact that we could have as healthcare professionals on policymaking. The interactions were a responsibility to engage and influence these policies that affect our patient lives and communities on a broader healthcare landscape. So it was really cool to be involved with that process. And again, following Dr. Thomas and the Tulane residents, to meet various representatives from Louisiana and be able to give my perspective as a medical student was really important. And I had the proper support from the team to get me on ready to answer questions about our 3 asks.
Correct. And Corey, as we develop a podcast like this, one of the important things is to mention so that whoever's listening on the podcast can, first of all, be from a mentor perspective on a daily basis. How can I, as a mentor, today I have somebody else, not Nadir, but how can I influence my underrepresented in medicine folks to pursue not only medical school, but urology? How does a mentor instill in these medical students the confidence that is needed? Because everybody thinks that urology is a difficult match process, difficult to get into. But then the mentors can work with the mentees at each institution and uplift them. That's what we do for all our medical students, so that they can become competitive for the urology match. It does take us a little extra time, but I think once you have the resources and once you have the determination, you can uplift. Maybe uplift may not be the perfect word, but you can certainly enhance the mentees' application process and make them competitive to match in urology. Building confidence in our mentees or the medical students is critical. Number one, building self-confidence for a career in medicine is critical, whichever field you're in. But certainly in a surgical specialty such as urology, where we are connecting with people and then, of course, not just take a deep breath, let me check your lungs and breathing, but now you're putting a robot in place into somebody's body, or an endoscope, or a surgical procedure. Then you need to make sure that the medical students and the residents build confidence for the next 35, 40 years of their career. And that's up to what I call faculty, mentors, any name you call them. They have to work with the mentees, the medical students, and then subsequently the residents.
And meeting Dr. Thomas was really special for me. Our initial conversation included a memorable breakfast at the hotel, where we shared our, life journeys, and it really highlighted his passion and resilience and powerful network. Dr. Thomas went over my resume, gave me key tips on how to get ready for residency applications, and offered interview preparation after the conference over Zoom, and many more things. He introduced me to incredible range of professionals, from Tulane residents to faculty across various institutions, widening my support system. So I'm really grateful for that pairing and opportunity.
Well, even though I would like the mentees to consider Tulane, but as long as their CVs, research, and their overall candidacy improves, and even if they go somewhere else, that's perfectly all right, as long as they are committed to urology and they get in. Certainly, I did tell Nader to consider New Orleans as one of his possible future homes, but then there are so many things that go into a choice being made that, I just wish him and the other mentees nothing but success in their career choice, residency choice, and their match choice.
Specifically for me, being at Howard doesn't have a urology residency program, but I've had incredible mentors within the Howard University Division of Urology, like Pamela Coleman, Leslie Dean, and Dr. Tonkin. They've been pivotal in guiding me towards the specialty. But the Futures program offered me a chance to expand my support network. I was fortunate to be paired with Dr. Thomas. And one of my other mentors, Dr. Kamora Scotland at UCLA, was actually the first Raju Thomas scholar. So it was neat to see Dr. Thomas's commitment to fostering the next generation of urologists.
Yeah, and again, when I see Kamora Scotland, who was the first AUA Endourology Fellow, which I instituted, is nothing but pride and joy, believe me, because she's doing so well. And she's going beyond urology and teaching, but going into the global arena of trying to take care of the less than fortunate in society around the world, how we can improve their access to urology care. Now, that's what I consider huge in terms of commitment, even though it's one person. The network around Dr. Scotland is nothing but pride and joy. So we can all aim high, like they say, aim for the sky and you will definitely hit the treetop. So that those are little things that we need to nurture in our younger generation, because there is no doubt that in the younger generation, there is a feeling that they need to give. I've found that. But now to channel the energies and the thought process of the next generation is so important. And I think the future program, the mentees at the Advocacy Summit are all pieces in the puzzle, pieces that can be put together to make sure that each individual mentee reaches their career potential. The career potential for anybody can be large, but then can you focus in so that you can really achieve what you are looking for? And for our mentees, it is improving where they are in their application process, candidacy process, and of course, matching process, And then, of course, like Dr. Scotland, take off.
I think what we learned at the summit is diversity in healthcare is crucial not only for direct impact on patient care, but overall the empathy and effectiveness of our healthcare system. And I believe medicine reaches the highest potential when healthcare professionals collaborate closely by prioritizing the best interests of their patients. And that's what happened at the summit. It was so amazing to see hundreds of urologists come together in one place. And as you know, currently we're facing a lot of rhetoric that aims to limit opportunities for underserved groups in medicine. So the research has consistently shown that diverse and representative healthcare workforce improves patient access to care, their perceptions of the quality they receive, and most importantly, their healthcare outcomes. This is very true of Black patients. When Black patients are treated by Black doctors, they report higher levels of satisfaction in their care. They receive the necessary preventative care and are more inclined to follow through with the recommended treatments. And diverse healthcare teams are vital for addressing these medically underserved communities. And one of the main talking points of the conference was that over 62% of counties don't have access to urologists. And underrepresented physicians are more likely to serve in these areas, directly countering the effects of healthcare shortages. So by supporting and expanding programs like AUA Futures and mentorship, we commit to improving healthcare for all by ensuring equitable and representative, inclusive healthcare.
I think it's important for the mentees to realize that even though they were with one or two urology faculty in the Futures program, that they need to understand that all the faculty who are there are available, so that you will have mentors from around the country. So you are, let's say, with me, but if you want to know, let's see what's going on in San Francisco. Let's see what's happening in New York. Let's see what's happening in Miami in terms of research, any other points of interest for my candidacy. What are they doing for rural health? There are certain pockets in the country that are really lacking not only healthcare, but basic needs of living. So how can we connect with those geographic zip codes that do not have it? Or is the Florida people able to do better? Is the Louisiana doing better? How can we improve? So that I think the mentorship program is not just for the AUA meeting, not just for the summit, but it should be a 365-day possibility of connecting with the various mentors. And now between text messaging and emails, that can easily be set up. So I think what is also important in podcasts like these is that this is not just a blip, but it's a sustaining, literally around the year mentorship. So whether it's Nader or anybody wanting to call me next week, if I'm in town, I will be able to respond. If they're visiting New Orleans, I'd be glad to meet them or have somebody in my department meet them. So this is an ongoing process, not just the few days here or the few days there. So Nader, thank you for joining us, because realistically, it's mentees like you who are the stars, and that's what we are here for as faculty and mentors. So I want to thank you for joining us, and thank you for your input, not only today, but also during the summit and during the visit with our lawmakers. So I think overall it was a great experience, and I want to thank you for your initiative and for the energy that you brought to the program so far.
Thank you so much, Dr. Thomas. And thank you so much for being so welcoming and making me a part of your team for all of the team meetings and Capitol Hill meetings. And I look forward to connecting with you in the future.
Surely. Absolutely. Thank you.
This has been Voices, an AUA News Inside Tract podcast, and is brought to you by the Diversity, Equity, and Inclusion Committee. For more information about the AUA's diversity, equity, and inclusion efforts, visit auanet.org/diversity.